New Mexico free CNA practice test with answers 180 questions exam prep. Question 1. What is a terminal illness? Option A. An illness that results in a full recovery. Option B. An illness for which there is no reasonable expectation of recovery. Option C. A minor cold or flu. Option D. An injury to the foot. The correct answer is option B. An illness for which there is no reasonable expectation of recovery. Terminal illnesses lead to the dying process and require comfort care. Question 2. What is an assisted living residence? Option A. A locked psychiatric hospital. Option B. A facility that provides housing and help with daily activities. Option C. A community for independent children. Option D. A surgical center. The correct answer is option B. A facility that provides housing and help with daily activities. Assisted living is for people who need some support but not 24-hour nursing care. Question 3. Who is the director of nursing? Option A. The person who cooks the meals. Option B. The registered nurse responsible for the entire nursing staff. Option C. The doctor who owns the building. Option D. The resident advocate. The correct answer is option B. The registered nurse responsible for the entire nursing staff. The director of nursing is the highest clinical administrator in a facility. Question 4. What is a skilled nursing facility? Option A. A place where residents do not receive any help. Option B. A facility that provides 24-hour nursing care and rehabilitation. Option C. A group home for people under 30. Option D. A place for vacations. The correct answer is option B. A facility that provides 24-hour nursing care and rehabilitation. These facilities are for residents with complex medical and therapy needs. Question 5. What does A&O times 0 mean? Option A. The person is fully aware. Option B. The person is awake but not aware of anything. Option C. The person is sleeping. Option D. The person knows their name only. The correct answer is option B. The person is awake but not aware of anything. This indicates a total lack of orientation to person, place, or time. Question 6. What does A&O times 1 mean? Option A. The person knows where they are. Option B. The person is aware of themselves. Option C. The person knows the date. Option D. The person knows their doctor. The correct answer is option B. The person is aware of themselves. This means the resident is only oriented to their own identity. Question 7. What does A&O times 2 mean? Option A. The person knows the time. Option B. The person is aware of self and place. Option C. The person knows the events of the day. Option D. The person is fully oriented. The correct answer is option B. The person is aware of self and place. Orientation to self and location is a mid-level of cognitive function. Question 8. What does A&O times 3 mean? Option A. The person is aware of self, place, and date or time. Option B. The person is confused about their name. Option C. The person is unconscious. Option D. The person only knows their name. The correct answer is option A. The person is aware of self, place, and date or time. Times 3 is a common standard for basic mental clarity in residents. Question 9. What is the definition of respite care? Option A. Care provided to a resident for the rest of their life. Option B. Short-term care provided to a person at home to give their family a break. Option C. Emergency care for a broken bone. Option D. A type of dental surgery. The correct answer is option B. Short-term care provided to a person at home to give their family a break. Respite care supports family caregivers by providing temporary facility placement. Question 10. Who is the healthcare professional that helps restore physical function like walking? Option A. Occupational therapist. Option B. Physical therapist. Option C. Social worker. Option D. Speech therapist. The correct answer is option B, physical therapist. Physical therapists focus on mobility, strength, and gross motor skills. Question 11. Who helps a resident return to their activities of daily living like dressing? Option A, a physical therapist. Option B, occupational therapist. Option C, social worker. Option D, a dietitian. The correct answer is option B, occupational therapist. Occupational therapists specialize in fine motor skills and daily tasks. Question 12. What is Medicare? Option A, federal health insurance for people aged 65 or older. Option B, state insurance for newborn babies. Option C, insurance provided by a local church. Option D, private insurance for wealthy people only. The correct answer is option A, federal health insurance for people aged 65 or older. Medicare is a federal program that supports the healthcare of the elderly. Question 13. What is Medicaid? Option A, insurance only for people with cancer. Option B, a program sponsored by the government and run by the state for low income. Option C, insurance provided by an employer. Option D, a type of bank account. The correct answer is option B, a program sponsored by the government and run by the state for low income. Medicaid provides healthcare access based on financial and medical need. Question 14. What is the primary role of an ombudsman? Option A, to perform medical exams. Option B, to help residents voice grievances and protect their rights. Option C, to manage the facility's finances. Option D, to drive the transport bus. The correct answer is option B, to help residents voice grievances and protect their rights. Ombudsmen act as independent advocates for residents in long-term care. Question 15. How are restraints ordered? Option A, by the nursing assistant. Option B, by the resident's family. Option C, by a doctor's order. Option D, by the facility manager. The correct answer is option C, by a doctor's order. Restraints are a medical intervention that must be legally authorized by a physician. Question 16. What is the definition of aiding and abetting? Option A, helping a resident walk. Option B, having knowledge of a crime without being present. Option C, cooking a meal for a coworker. Option D, reporting a safety hazard. The correct answer is option B, having knowledge of a crime without being present. This is a legal term for being involved in or having knowledge of an illegal act. Question 17. What is the definition of ethics? Option A, the laws of the state. Option B, the knowledge of what is right and wrong. Option C, the facility's dress code. Option D, the religious beliefs of the doctor. The correct answer is option B, the knowledge of what is right and wrong. Ethics guide the moral and professional behavior of healthcare workers. Question 18. What is libel? Option A, making false statements about a person orally. Option B, making false statements about a person in writing. Option C, touching someone without consent. Option D, failing to provide care. The correct answer is option B, making false statements about a person in writing. Libel is the written form of defamation of character. Question 19. What is malpractice? Option A, a mistake made by a nursing assistant. Option B, a negligence by a professional person like a doctor or nurse. Option C, stealing property from a resident. Option D, entering a room without knocking. The correct answer is option B, negligence by a professional person like a doctor or nurse. Malpractice is a specific legal category of negligence for licensed professionals. Question 20. What is neglect? Option A, touching someone without permission. Option B, a failure to provide a person with service to prevent harm. Option C, a threatening to hit a resident. Option D, asking too many questions. The correct answer is option B, failure to provide a person with service to prevent harm. Neglect occurs when a caregiver fails to meet a resident's basic needs. Question 21. What is negligence? Option A. A professional crime. Option B. An unintentional wrong where a person did not act in a reasonable manner. Option C. Threatening someone with physical force. Option D. Giving a resident a gift. The correct answer is option B. An unintentional wrong where a person did not act in a reasonable manner. Negligence involves failing to provide the standard of care that a reasonable person would. Question 22. What is slander? Option A. Making a false statement in writing. Option B. Making a false statement orally. Option C. Stealing money. Option D. Forcing a resident to eat. The correct answer is option B. Making a false statement orally. Slander is the spoken form of defamation of character. Question 23. What is defamation? Option A. Improving a person's reputation. Option B. Injuring a person's reputation by making false statements. Option C. Providing excellent care. Option D. Recording vital signs accurately. The correct answer is option B. Injuring a person's reputation by making false statements. Defamation includes both slander and libel. Question 24. What is false imprisonment? Option A. Locking a person in their own home. Option B. Unlawful restraint or restriction of a person's freedom of movement. Option C. Touching someone without consent. Option D. Failing to answer a call light. The correct answer is option B. Unlawful restraint or restriction of a person's freedom of movement. Restricting a person's movement without medical or legal cause is a crime. Question 25. What is the definition of fraud? Option A. Being honest with a resident. Option B. Saying or doing something to deceive a person. Option C. Taking a resident's pulse. Option D. Applying a bandage correctly. The correct answer is option B. Saying or doing something to deceive a person. Fraud involves intentional deception for personal or financial gain. Question 26. What is assault? Option A. Hitting a resident with your hand. Option B. Threatening to harm someone without consent. Option C. Providing a bed bath. Option D. Washing your hands. The correct answer is option B. Threatening to harm someone without consent. Assault is the threat of force that makes a person fear for their safety. Question 27. What is battery? Option A. Threatening to hit someone. Option B. Touching someone without their consent. Option C. Ignoring a resident's request. Option D. Reporting a fall to the nurse. The correct answer is option B. Touching someone without their consent. Battery is the actual physical act of non-consensual or harmful contact. Question 28. What is the concept of holism in care? Option A. Only treating the disease. Option B. Considering the whole person including physical and social needs. Option C. Treating everyone in the building the same. Option D. Focusing only on the heart. The correct answer is option B. Considering the whole person including physical and social needs. Holistic care addresses the physical, emotional, and social aspects of a person. Question 29. What does it mean if a resident is comatose? Option A. They are very talkative. Option B. They are being unable to respond. Option C. They are able to walk but not talk. Option D. They are sleeping normally. The correct answer is option B. They are being unable to respond. A coma is a state of deep and prolonged unconsciousness. Question 30. What is Maslow's hierarchy of needs? Option A. A list of facility rules. Option B. A scale of basic human requirements for health and well-being. Option C. A dietary plan for residents. Option D. A way to measure blood pressure. The correct answer is option B. A scale of basic human requirements for health and well-being. The hierarchy prioritizes survival needs like food and air over social needs. Question 31. What is paraphrasing in communication? Option A. Interrupting the person. Option B. Restating the person's message in your own words. Option C. Asking yes or no questions. Option D. Changing the subject. The correct answer is option B. Restating the person's message in your own words. Paraphrasing helps confirm that you have correctly understood the resident. Question 32. What is the branch of medicine called bariatrics? Option A. The care of infants. Option B. The treatment of obesity. Option C. The study of the eyes. Option D. The care of the dying. The correct answer is option B. The treatment of obesity. Bariatric medicine focuses on the unique needs of individuals with high body mass. Question 33. What is homeostasis? Option A. The process of a disease getting worse. Option B. Any process living things use to maintain survival and stability. Option C. The growth of a muscle. Option D. The loss of the sense of smell. The correct answer is option B. Any process living things use to maintain survival and stability. Homeostasis keeps vital signs like temperature within a healthy range. Question 34. Which tissue stretches and contracts to let the body move? Option A. The nerve tissue. Option B. Connective tissue. Option C. Muscle tissue. Option D. Epithelial tissue. The correct answer is option C. Muscle tissue. Muscle tissue is specialized for generating physical force and movement. Question 35. Which tissue receives and carries impulses to the brain? Option A. Muscle tissue. Option B. Epithelial tissue. Option C. Nerve tissue. Option D. A connective tissue. The correct answer is option C. Nerve tissue. Nerve tissue acts as the communication network for the entire body. Question 36. What is the largest organ in the human body? Option A. The liver. Option B. The heart. Option C. The skin. Option D. The lungs. The correct answer is option C. The skin. The skin protects the body and regulates temperature and sensation. Question 37. How many total bones are in the human body? Option A. 150. Option B. 206. Option C. 300. Option D. 412. The correct answer is option B. 206. The human skeleton provides structure and protects internal organs.